So good day, ma'am. I am Geraldine Kinyal, your student nurse for today. So before we start, may I know how would you like me to address you?
You can call me ma'am po.
Okay, so today, ma'am, I will be conducting a physical examination. But before that, I would like to ask for your consent, for I will be touching some specific parts and areas of your body. For it is crucial to do so, so I can take note and accurate and complete data. Would that be alright, ma'am?
It's okay po ma'am.
So rest assured, ma'am, that all the findings in this assessment will remain confidential between me and the attending physician that I will be referring you to. So now, ma'am, may I ask if you have any jewelries in your body?
Yes ma'am, I have a bracelet and how I have watch and necklace.
May I request, ma'am, that you take it off? And you can also change your clothes, ma'am, with discount. May I know what language or dialect do you prefer, ma'am?
I prefer using English ma'am.
So, ma'am, I will just perform hand hygiene and I will use the gloves for it is necessary to do so. I will also close the curtains to provide your privacy.
Okay po ma'am.
We will start in skin assessment, ma'am. I will be assessing your skin, and in order for me to assess your skin, I will touch it, ma'am. Is it okay for me to touch it?
It's okay lang po ma'am.
Now, I will be inspecting your skin for color variation and pigmentation. So, can I touch your skin, ma'am?
Okay po ma'am.
So, I will palpate for the mobility and turgor of your skin, ma'am. So, can I pinch your skin, ma'am? I will be palpating your skins for any lesions and texture. In palpating the thickness of the skin, I will be using my finger pad. So, can you hand me over your arms again, ma'am?
Okay ma'am.
I will be palpating the temperature and the moisture of your skin, ma'am. In palpating the temperature, I will be using the dorsal part of my hand. So can I touch your face, ma'am?
Yes, ma'am.
So for the skin is evenly colored without unusual or prominent discolorations, no skin breakdowns and lesions. The skin is intact. There are no presence of stretch marks and scars in your arms. Your skin is soft and even. For the temperature and moisture, the skin is also dry and not oily. It's as light moist. So next is the thickness. Thin, it is thin, with callosis melted and plantar surface of good feet. So mobility and turgor, it can be reached easily and it immediately returns to its original positions. So for the there is no presence of edema. For the head and face assessment, ma'am, first I will inspect and palpate your head. Is it okay, ma'am, if I touch your head?
It's okay, ma'am.
Let us now proceed to your face, ma'am. So I will be checking your temporomandibular joint. So can you open your mouth now? Can you open it widely? Do you feel any discomfort or pain in opening your mouth, ma'am?
No, ma'am.
I will inspect and observe your face, ma'am, for its sanity. Can I touch your skin? Oh. For the scalp and hair, the hair is black, the scalp is clean and dry, with sparse dandruff visible. Hair is smooth and firm, without lesions or lice infestations. While the head and face, the head is symmetrical, it is round, it is erect, it is in the midline, and is normal cephalic, which means the head is appropriate for the body. No presence of lesion, scar, or masses present in the head. There are also no parasites such as lice and no observed alopecia. No swelling observed, no clicking when the mouth was opened earlier and the TMJ was palpated. Next is the nail assessment. I will be assessing your nails, ma'am. I am checking if the nail plate is attached in the nail bed. And for the capillary refill, I will be pinching your nails. Is it okay, ma'am?
Okay lang po, ma'am.
The nails are round, clean, smooth, and firm. Your nail plate is firmly attached to the nail bed, in which the nail bed is transparent and pinkish. For the eyes and vision assessment, first, I will inspect the eyeballs, the symmetry of the eyeballs, and any protrusion. So I will touch your face, ma'am. In assessing your iris, ma'am, I will note for its shape and color. So I will touch your face again. Next is I will inspect the eyelids together with your eyelashes. And we will note for its position, appearance, color changes, and blinking. Can you open and close your eyes, ma'am? Close. Open. So for your upper and lower palpebral conjunctiva, I will note for any swelling, lesions, foreign bodies, trauma, or discharges. So I will first start at your lower palpebral conjunctiva. So I will pull the lower lid and observe for any swelling, lesions, foreign bodies, trauma, or discharges. Are you ready, ma'am? And for your upper palpebral conjunctiva, I will grasp the upper lid with the use of cotton planchet and observe for any swelling, lesions, foreign bodies, trauma, or discharges. So are you ready, ma'am?
Okay, ma'am.
For the eyebrows, I will inspect it and observe for its color, symmetry, and distribution. Next is inspecting and testing the accumulation of your pupils. I will note the shape, size, and accumulation of your pupil, ma'am. So first, I will just inspect it. Next is, I have your pen, and all you have to do is to follow the movement of the pen. Okay, let's start. So for the assessment of your color vision, I have here an Ishihara plate to test your color vision. And all you have to do, ma'am, is to state the numbers that are highlighted in your sight as you look at these plates. So are you ready, ma'am?
Yes, ma'am. 25, 29, 45, 56, 6, 8.
In assessing your cornea and lens, I will note for its appearance. In doing this, ma'am, I will be using a pen light and let it up in the both sides of your eyes. So, are you ready, ma'am?
Yes, ma'am.
For the cover test, ma'am, I have here an index card, and I will use this to cover your eyes one at a time. So all you have to do is to look at a distant object. So are you ready, ma'am?
Yes, ma'am.
For the cardinal case, ma'am, I will do positions test. So I have here my pen light, and all you have to do is to follow the movement of the pen light without moving your head. So can we start, ma'am?
Yes, ma'am.
For your bulbar conjunctivae and sclerae, we will note for its clarity, color, and texture. So now I will instruct you, ma'am, to move your eyes side to side and upward.
Okay, ma'am.
For the lacrimal apparatus, I will note for any swelling, redness, drainage, and tenderness. So I will start, ma'am. In testing the direct and consensual papillary reaction to light, I already switched off the light, and I will be using my pen light for the testing. So all you have to do, ma'am, is to look straight. So let's start. So to measure your distant vision acuity, I will be using a Snellen chart. So you are 20 feet away from the Snellen chart, and all you have to do is to state the letters that I will be pointing on. So you have also to cover your one eye. So let's start in 2020.
D, E, F, P, O, T, E, C, L, E, T, O, D, F, O, T, R, D, P, L, T, O, D, O.
Other eye.
D, E, F, P, O, T, E, C, T, D, P, D, O, F, E, L, F, D, F, L, T, C, E, D.
So for your near vision acuity, I will be using a handheld Snellen chart, and I will place it 12 to 15 inches away from you while you are covering your one eyes and vice versa using a index card. So all you have to do is to state the letters from the top to bottom. So are you ready, ma'am?
Okay, ma'am. Yes. E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, C, L, E, F, O, D, P, C, T. E, F, P, T, O, Z, L, P, E, D, PECFD, EDF, CZP, FELO, PZD, DEF, PO, TEC, LEFO, DPCT.
So when assessing your peripheral vision or confrontation test, I will first place myself in front of you while our eyes meet at the same level. And all you have to do, ma'am, is to state the numbers that is indicated in my fingers. So, are you ready, ma'am?
Yes, ma'am. 2, 3, 1, 5.
Upon inspecting the pupils, these are round and 3 ml in size. Also, the illuminated pupils constricts and pupil opposite the one illuminated constricts continuously. Moreover, pupils converge and constrict as object moves in toward nose. Pupil responses are uniform. So upon testing and inspecting the direct and consensual pupillary reaction to light, I observed that it is constriction. While in the covered test, upon inspection, the covered eye remains fixed and the uncovered eye does not move as covered is removed. So for the cardinal gaze, upon inspection, both eyes move in a smooth and coordinated manner in all 6 directions. So the client was able to identify all the 6 screening Ishihara plates correctly, and also she was able to identify the revealed number in the dot pattern. So with the use of the Snellen chart in measuring the distance and vision acuity, upon inspecting, the client was able to identify the letters that starts in 2020 without hesitation, frowning, or squinting. So while in the near vision acuity, upon inspecting, the client was able to read the printed letter at 12-15 inches without difficulty. So with the peripheral vision, the confrontation test, upon inspecting, the client sees my finger at the same time. Upon inspection, the eyeballs are symmetrically aligned in the sockets without protruding or sinking. So your eyebrows, upon inspecting the eyebrows, these are the same with your hair color, symmetric and are evenly distributed. So upon inspection, the eyelashes are short, evenly spaced, and are curled outward. The lower lid margins at the bottom edge of the iris, while the upper lid margins covered approximately 2 mm of the iris. Also, the lid margins are pink, moist, and without swelling of lesions. Lastly, both the upper and lower lid margins are closed easily and meet completely when closed. Upon inspection, the bulbar conjunctivae and sclerae are clear, moist, smooth, and with tiny visible vessels, and the sclerae are white. So the palpebral conjunctivae, the upper and lower, the upper conjunctivae are pink, moist, and free from swelling, lesions, foreign bodies, trauma, or abnormal discharges. Upon palpating and inspecting, the puncta is visible without swelling or redness, no tenderness or drainage noted, and minimal lacrimation. So for the inspection in the cornea and lens, these are transparent, moist, and without opacities. and the lens are clear, while the iris, they are round and are uniform in color. So, upon inspecting the pupils, they are round, about 3 mm in size. So, we are now here in the ears and hearing assessment, ma'am. So, with the test in the external ear, I will note for its discoloration, lesions, discharges on the auricle, lobule, and the tragus. Also, its tenderness on the auricle and mastoid process. So I will first get my ruler to measure your ears. So next, ma'am, I will be using my pen light to check in your ear canal. So for the hearing assessment, ma'am, we will be conducting a whisper test. So in whisper test, kindly cover your one ear and I will whisper 2 syllables word on the uncovered ear. And you need to repeat what you have heard. So, okay, ma'am?
Yes, ma'am.
So first, you have to cover your right ear and next is the left ear. So I'll be staying behind you.
Okay, ma'am. River. Ruler.
Weber test, ma'am. I will be utilizing a tuning fork. And to use this tuning fork, first I will activate this in my elbow and I will put it at the top of your head. So are you ready, ma'am? Can you hear a sound or a vibration, ma'am?
Yes, ma'am.
Where do you hear it more loudly?
In both
Under-
ears, ma'am.
Okay. So now, ma'am, for the watch tick test, you will also cover your one ear while I place a watch on the uncovered one. And tell me, ma'am, if you hear it.
Okay,
So
ma'am.
let's start.
I can hear it, ma'am. I can also hear it, ma'am.
Next is the ringing test. So I will be putting the tuning fork in the areas of your ears, ma'am. I will activate this tuning fork with the use of my elbow. So are you ready, ma'am?
Yes, ma'am. Already stop, ma'am. Already stop now.
For the ears and hearing, it is symmetrically equal in size, bilaterally about 5 cm. So the auricle position, the pinna in line with lateral canthus of both eyes. Earlobes are free. For the external ear, it is smooth, without lesions, lumps, or nodules. Color is consistent with the rest of the color of the body, with facial color, no discharge present, no tenderness, and mastoid process. The external canal has no tenderness in the manipulation of the auricle. Small amount of moist, yellow, odorless cerumen noted. The canal walls are pink, smooth, and without nodules. Tympanic membrane shiny and pearly gray. So for the whisper test, I repeat whispered two-syllable word at 2 feet distance. Well, the client can clearly hear the tick of the clock. For the Weber test, the vibration heard equally well in both ears. No lateralization of sound to either ear. While in the Rene test, air conduction sound heard longer or twice as long as the bone conduction sound. So now for the nose and sinuses, ma'am, I will first inspect and palpate the exterior part of your nose. So I will note for the nasal color, shape, symmetry, consistency, and for the tenderness. Do you feel any pain or discomfort, ma'am?
None, ma'am.
To inspect the internal part of the nose, I will be using a pen light, ma'am. So I will be noting for any discoloration, exudate, lesions, and consistency. And also the position of your nasal septum. So I'll touch your nose, ma'am. For the patency test, ma'am, this is done by uploading one nares and let you inhale and exhale on the nares that is not uploaded. So this is to check the state of being open or unobstructed of the nasal patency. So can we start, ma'am?
Yes, ma'am.
So inhale, exhale, inhale, exhale. Inhale, exhale, inhale, exhale. So in assessing the sinuses, ma'am, I will palpate and percuss the frontal and maxillary sinuses. So I will be palpating and percussing the frontal and maxillary sinuses. And I will be noting if there is any tenderness or sound abnormalities. So I will touch your face again. Do you feel pain or any discomfort, ma'am?
No, ma'am.
For the external portion of your nose, the color is consistent with the rest of the face. It is smooth and symmetric. No tenderness noted. So in the patency, it is the patient able to sniff and blow through each nostril, which other is occluded. So the internal portion of the nose, the nasal mucosa is dark pink, moist, and free of exudate. So the nasal septum is at midline and intact, free of ulcers or perforations. So the sinuses, the frontal and maxillary sinuses, are non-tendered palpation and percussion. Before that, I would like to ask you some questions. So, how many times do you brush your teeth?
Approximately 2 times a day.
Do you have any dental appliances, just
No,
like
ma'am.
brace or dentures?
None, ma'am.
Okay, so I will start in your lips, in examining your lips. So, can you purse your lips, ma'am, as if you are whistling? So next is, I will be checking your inner lips, the buccal mucosa, and your gums. So can you open your mouth, ma'am? For the uvula, I will note the characteristics, the color, the texture, the redness, exudate, lesions, and if there is a presence of nodules or any abnormal tissues. So open your mouth again now. So yeah, again inspect your teeth and gums, ma'am. But to do that, I will be using a tongue depressor to clearly state the following: the number of teeth, the color, condition, and its alignment. When you open your mouth, ma'am. Okay, so next is your tongue. Can you open widely your mouth, ma'am, and lift your tongue upward, side, side to side. Okay, up, up, side, and for the oropharynx, I will be noting the color, the presence of exudate and lesions. So I will be using again my pen light and my tongue depressor. So open your mouth, ma'am. Checking your gag reflex, ma'am. I will use again my tongue depressor and I will place it in the mid part of your tongue. And you have to react with the stimulus. So open your mouth, ma'am. For the mouth and oropharynx, the lips are pinkish, smooth, and moist, with lesions, but with no lesions or swelling. Well, the teeth are 22. It is white to yellowish teeth. No repaired or decayed areas, no dental appliance. The gums are pink, moist, and firm, with the tight margins to the teeth. No lesions, redness, or swelling lesions. For the buccal mucosa, it is pinkish, smooth, and moist, without lesions. While the tongue is moist, pinkish, at midline, without lesions, nodules, or fasciculations. The papillae are present on dorsal surface. The ventral surface are smooth and skinny, with small visible vessels present free along in the midline. For the palate, it is pinkish hard palate with a firm transverse reggae, smooth, pink and moist. Soft palate has tall lesions noted. Although uvula, it is pinkish, moist, hangs freely in the midline without redness or exudate. So the tonsils are normal in shape, normal in size. It is pink, symmetric without exudate, swelling or lesions. While the oropharynx, it is pink without exudate and lesions. So for the gag reflex is intact. So for the neck and lymph nodes assessment, I will first check your neck in all angles as well as its symmetry.
Okay.
So now, can you stick out your tongue, ma'am? So again, ma'am, I will be handing you a cup of water, and you will drink it again when I say so. And drink it, ma'am. So in testing the patient's range of motion, all you have to do, ma'am, is to follow this object with your head.
Okay, ma'am.
So let's start. So now, ma'am, I will be palpating your trachea and your thyroid. Assessing the following lymph nodes. The neck is symmetric with head centered. There is no presence of lumps or bulging masses. I've also observed that the thyroid cartilage, cricoid cartilage, and the thyroid gland move symmetrically upward as you swallow the water. There is also no signs of thyroglossal cyst. So for the range of motion, it is full, smooth, and controlled. The trachea is found in the midline. Thyroid gland landmarks found in the midline, palpable when the client swallows, is smooth, firm, no tender, and without nodules and roots. So the lymph and nodes are palpable. So that's all for the physical examination. Thank you, ma'am, for your time and cooperation.
You're welcome, ma'am.